For me, my journey to becoming a scribe, I initially have a degree in meteorology, and when I moved to the Big Island, I was having difficulties finding a position within that field. And then a friend of mine told me that they were hiring scribes for the ER, and I applied, and here I am. To stop off at the university. I'm going to post some job flyers, and then I'm going to talk to one of the advisors who I try to recruit students from, so we kind of go over what we're looking for, the types of students who might be interested in the position.
You get put into a position where you get to experience the emergency side of medicine or different aspects of medicine, and you get to see whether or not that career path is good for you. Either you're going into nursing or becoming a doctor or pharmacist even. You get to experience that kind of environment. So it prepares you for the medical field and actually tests you whether or not you actually want to go into medicine or not.
Now I'm on my way to the hospital. I have an interview set up for a potential new hire. So we'll show them a little PowerPoint presentation of what ScribeAmerica is about and what we're looking for in a scribe. And we'll see if she's a good candidate. I look for individuals. There's a lot of students that we see apply. So we set up a time to do an interview. We go over a PowerPoint presentation about what it's like to be a scribe and what we're looking for in a scribe. And then we do individual interviews to gain kind of what kind of person they are and what we're looking for. What interests you about this job?
I wanted to apply for the position because I am a pre-med student, and so I want to be able to use my skills to help the doctors do their job more effectively, and then also gain some really valuable experience in a clinical setting.
Yeah, that's good. So as a scribe, we are like the personal assistant to the NER physician. We follow them around and document their patient interactions. When the doctor goes in and examines a patient and talks to them about what brought them into the ER, we document all of that. But also there's other things. They might do procedures. If somebody comes in with a cut, the doctor will perform a procedure to fix that, and we will document that. Any updates that the patient might have. If they're feeling better, we want to document that, or if something changes in their condition, we follow the doctor and document that kind of encounter.
Having scribes work with us in the ER makes our job infinitely easier. They keep track of things. They let us know when labs are back, or EKGs, or imaging. And a lot of what we do is timed, like something has to happen in 3 hours or in 4 hours, and they completely keep track of the time. It's like, it's 4 hours, you need to go do this, and then I go and do that. So they have just made our lives infinitely better.
So being a manager to the scribes, I currently have about 16 scribes on staff that I'm available to during the day should an emergency arise. So just make sure that automatically you look for that, and then just review their charts for billing to make sure that we are meeting the criteria for the doctors to have a complete chart.
How long are the residents staying?
The best thing about being a scribe is that you do the same things every day, so you get used to your job, but it's a different day every day. You never know what you're going to see in the ER. There's different patients every day, different doctors that you work with. Having the same type of job but being different every day makes it really exciting.
My experience as a scribe has been very good. I've learned a lot about the emergency department. I learned a lot about different illnesses, and I feel like it does complement my medical experience overall.
I mean, it gives you an invaluable experience as far as giving you a leg up in nursing school, medical school, or whatever you're trying to pursue in the medical field.
So being a scribe, I have been able to see many different aspects of what happens in the hospital to try to help someone with probably their worst day of their life being in the ER, that they can have a positive experience, try to make somebody's day a little bit better. And so that's why I've decided to become a nurse. My advice would be to a future scribe would be to make sure that you make the time for yourself, that when you go to work, you work hard and do what you need to do while you're there, but then when you're at home, that you make sure you do what you need to do to unwind and relax, read, go to the beach, whatever it is for you to unwind, just make sure that you make the time for yourself to do that. Hilo in general, I think, is just a really great place to be. You get to just be in the moment and live with nature is really awesome, and I like being here.